What is the difference between acute and protracted withdrawal when it comes to coming off of antidepressants? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And one of the questions that's come up multiple times in some of my other videos is, what does protracted withdrawal look like as opposed to acute withdrawal, and how can you tell the difference? So one of the best ways to tell the difference between them is the timing of onset. So acute withdrawal is usually going to occur within days, sometimes even hours to weeks after stopping an antidepressant. So those that have a longer half-life, like fluoxetine, you might not notice these symptoms until a couple weeks later, but usually it's going to happen sooner than that. As opposed to protracted withdrawal, when this typically occurs many weeks to months after discontinuation of the medication. So a lot of times someone might have some acute withdrawal symptoms, they try and white knuckle through it, and then they think that they're fine and all their withdrawal symptoms have gone away, but then lo and behold, a few weeks to months later, they're starting to develop all of these symptoms and they're like, what the heck is going on? What do the symptoms actually look like? So in acute withdrawal, we're usually thinking about things like flu-like symptoms. Brain zaps are kind of pathognomonic for withdrawal from antidepressants. There can also be things like headaches, dizziness, stomach upset, insomnia, mood lability, crying spells, anxiety, irritability, aggression, sometimes akathisia, where you have a lot of restlessness and you have to move around, sometimes thoughts of SI, and in rare cases, it can actually trigger mania. Now, this list isn't exhaustive, but those are kind of the main ones. When it comes to protracted withdrawal, a lot of these symptoms can also occur with this. However, there are a lot of other potential symptoms that can be caused by protracted withdrawal, and usually the intensity and the duration with which they last are going to be much longer. So it can essentially affect any system in the body. So from a mental health perspective, it can cause severe anxiety and panic, insomnia, mood lability, severe depression. From a neurologic standpoint, there can still be those brain zaps. There could also be neuropathy, like numbness and tingling all over. There can be akathisia, which is, again, this sense of restlessness. Let me tell you, so many people on this app have told me that when they get the akathisia, it's been so severe that it's causing them SI. They just can't get any relief from it. People can have gait disturbances. There can be significant cognitive impairment. I've had people tell me that they forgot how to read and write. Memory issues, not being able to recall old memories or formulate new memories. There can be things like dysautonomia, where basically your body is not able to keep its vitals within a normal range. So your heart rate might go really high or really low. You may have really high blood pressure or low blood pressure. You may be breathing really fast or breathing slower than normal. You may have issues with temperature regulation. There could also be severe gut disturbances. I've had multiple people tell me that because of the gut issues, they develop SIBO, and then that just propagates more gut issues. So certainly this can look like constipation, bloating, gas, diarrhea, nausea, vomiting. Sometimes people have urinary issues or incontinence. There can be muscle aches and pains, and certainly headaches. Sometimes there's persistent sexual dysfunction or severe emotional blunting. I'm sure this isn't an exhaustive list, but I'll stop it there. If you guys have had this manifest in other ways, then feel free to share in the comments. One other way to tell the difference between protracted and acute withdrawal symptoms is how long they last. So usually acute withdrawal symptoms are going to resolve within a few weeks. However, sometimes they can go straight into protracted withdrawal symptoms, in which case someone may not get any relief. But in contrast, the protracted withdrawal symptoms can last for quite some time. We're talking about years. So although they do tend to improve over time, it can certainly be a long haul. And so it's important that these individuals have the support that they need in order to be able to get through this. So hopefully that clarifies a little bit about the difference between acute and protracted withdrawal symptoms when it comes to antidepressants. If there are other questions you have on this topic, then please put them in the comments below. I'm also getting together an email list for those of you who may be interested in my content, because they may have future courses or offerings or resources that I want to share directly with you all. And so that would enable me to do it. So if that's you, then send me a DM with your email, and I hope to see you in the next one.